Hello, I am Vekutolu Rhesu, Assistant Professor from the Department of MLT, Assam Downtown University. So in this session, I'll be talking on HIV tri-dot rapid test. So what is this HIV tri-dot test? This HIV tri-dot test is used to detect the level of antibodies to HIV-1 and HIV-2 in the blood. It is used to confirm HIV infection after potential exposure, and this test is also used to assess the progress of HIV treatment. So the main principle of this HIV tri-dot rapid test is this HIV antigen are immobilized on a porous immunofiltration membrane. Sample and reagent passed through the membrane are absorbed into the underlying absorbent. As sample passes through the membrane, HIV antibodies, if present, bind to the immobilized antigen, and the conjugate binds to the Fc portion of the HIV antibodies to give the distinct pinkish purple dots against a white background. So in order to perform this test, we will require the HIV tri-dot kit, which is commercially available, and the serum. So the serum should not be hemolyzed. And then in this HIV tri-dot kit, the buffer solution is available, the dropper, and also the protein A conjugate. So the method I will be explaining on the rapid slide method. So firstly, what you have to do is you have to bring all the specimen and reagent to the room temperature before performing the test. So and then you have to tear off the pouch, take out the device of the HIV tri-dot and place it on a working table or area. Now you have to add 3 drops of buffer solution to the center of the tri-dot device. Then add 1 drop of patient serum using the sample dropper, which is provided in the kit. And remember, you should use separate dropper for each sample. Now again you have to add 5 drops of buffer solution, then again add 2 drops of the liquid conjugate directly from the conjugate vial, then add 5 drops of buffer solution and read the result. Now here in the interpretation, if the first HIV tri-dot shows that it is non-reactive. So if only 1 dot appear, that is in the control dot, here it is showing the control dot, the specimen is non-reactive for the antibodies either to HIV-1 or HIV-2. So you can interpret the sample as the as non-reactive. But here in the second one, if 2 dot, that is 1 for the control and 1 for the HIV-1 appear, the specimen is reactive for antibodies to HIV. Now in the second one, if 2 dots, 1 for the control and the other for the HIV-2 appear, the specimen is reactive for antibodies to HIV-2. Now here again in the third dot, if all the 3 dots, 1 each for control, 1 for the HIV-1 and 1 for the HIV-2 appear, the specimen is reactive for antibodies to HIV-1 and HIV-2. But here in the control, the last one, if the control dot fails to appear, it is because of the insufficient specimen or volume or incorrect procedure techniques. So these are the most likely reason for the control failure. So in this case, you have to repeat the test using a fresh sample and also the new HIV tri-dot device. So this is all about HIV tri-dot rapid test.